representing United Workers of Integral Care, and I just wanted to take some time to read the email that we had sent to all of you as board members. Dear Integral Care Board of Trustees, we have been organizing for nearly a year to form an independent employee union at Integral Care. Last month, we met with Mr. Evans and asked that he work with the Integral Care Board of Trustees to pass our union's proposed consultation policy. We offered to discuss any objections or feedback he had regarding our proposal. We are disappointed in the response that we received from him. His response suggests that the employee proposed consultation policy is unnecessary because he has created an EAC. We want to make it clear to you as board members why a CEO-created EAC undermines and undervalues our union and the voices of Integral Care employees. We began organizing our union because we love the work that we do and the clients that we serve. That said, we have long felt unheard and undervalued when it comes to the problems facing our agency. Many of us have raised our concerns for years to executive management with little to no response. Our proposed consultation policy would give our union a framework for having ongoing relationships with you, the board, and with executive management to make decisions about agency programs and priorities and to solve problems together. This proposed policy is firmly within the bounds of Texas state law, particularly as it relates to the prohibition of public agencies engaged in collective bargaining, and it's consistent with policies and rights that other public employees have across Texas. We believe that through our union, we will have an independent voice to share our knowledge and experiences with executive management. Through our union, we can be sure that the will of the employees will be determined democratically and acted upon with a unified voice, free of influence from executive management. This will also help us better retain staff and provide a higher quality of care to our clients across Austin-Travis County. We, the employees, created our union, and it's open to everyone who works at Integral Care outside of executive management. This stands in contrast with the EAC, which was created by executive management and would only be open to 16 employees. Staff need a real seat at the table that is truly our own, not just a small advisory committee created by the CEO. Lastly, as an independent employee union, we would be a strong partner for Integral Care leadership in a way that the EAC could not. With the autonomy and power of an employee-led union, the Integral Care board and CEO will have a ready ally in dealing with the community and elected officials at every level of government. We urge you to consider and adopt our consultation policy. We stand ready and available to discuss any feedback or counter proposals you might have. Thank you.
We are going to discuss if there were any issues with the consultation policy. So to the extent that everyone wanted to emphasize those points, we appreciate those points, and I think we're going to be able to find a way of meeting your needs and meeting our needs.
Hi, my name is Melanie Babbitt. Thank you for giving me the time to speak. I am a member of United Workers of Integral Care. I am also an employee. I've worked here for 3 years. I work in IBD crisis prevention. I provide therapeutic skills training and case management to people who have IBD and serious mental illness. I joined the union for the same reason that I became a social worker and the same reason that I became an employee here. I want to see the conditions improve. We know historically and currently that conditions improve when employees organize. The Employee Advisory Council is not what the employees are asking for. What we want is a strong independent union that all employees can join. If the board wants the Employee Advisory Council, that is great, but it's just not a substitute for the union. A union is democratic, it's employee-led, it's independent and outside of control. The consultation policy that we presented has been reviewed by lawyers, it's 100% legal, and it puts us on the same footing as other public employees such as Travis County, City of Austin, AISD. Conditions improve when workers organize, and our clients and our community deserve the best conditions. Thank you.
Seth Hutchinson. I'm an organizer with Communications Workers of America, and I've been working with the organizing committee here at United Workers of Integral Care for going on a year now. It's really been a pleasure to work with them and get to know them and get to support their efforts here. But I wanted to read a letter from our legal counsel who has been, who helped us review the consultation policy that's been put before y'all. And so I wanted to read that just to clear up any kind of legal confusion or questions about that, and hopefully clear up any confusion on that. But it's from Martha Owens of Dietz, Durst, and Owens. And she says, I have been asked by UXCWA to review the consultation policy that's proposed for adoption by the Integral Care Board. More specifically, UXCWA has asked me to provide a legal opinion as to whether Integral Care may legally adopt the proposed policy. My understanding is that Integral Care has expressed its view that the adoption of such a policy may be prohibited by law because Integral Care is a public entity. For the reasons detailed below, there is no legal barrier to the adoption of such a consultation policy. Integral Care is a community center created pursuant to Chapter 534 of the Texas Health and Safety Code. A community center created under the law is an agency of the state, a government unit, and a unit of local government, as well as a political subdivision. Under Texas law, public entities such as Integral Care may not enter into a collective bargaining agreement with a labor organization because that is specifically prohibited under Texas Labor Code, which provides that a political subdivision of the state may not enter into a collective bargaining contract with a labor organization regarding wages, hours, or conditions of employment of public employees. A policy that provides only for consultation with employees or their labor organizations is not illegal. Texas courts have defined a collective bargaining agreement in the following manner. A contract or agreement resulting from collective bargaining must of necessity be a bilateral procedure culminating in a meeting of the minds involved in binding the parties to the agreement. A policy that provides only for a process under which employees and their chosen labor organization consult with management about issues of concern, but which does not result in a binding agreement, is not equivalent to collective bargaining. Defining collective bargaining for private sector workers as a negotiating process that results in the execution of a written contract incorporating agreed terms. Here, all that is being proposed is that Integral Care adopt a policy that provides for a regular process under which the entity will consult with representatives from employee labor organizations to discuss working conditions and other issues of concern to employees. The proposed policy even explicitly states that collective bargaining is not permitted. The policy being proposed is clearly not collective bargaining, as that term has been understood and applied by the courts, since it will not result in bilateral contract binding both parties. Please let me know if I may be of additional assistance. Signed, Martha Owen. Thank you.
Hello, my name is Juliana. This is literally like my worst fear, but I feel like if I don't say this, I will regret it. About 3.5 minutes, so bear with me, because it's important. So, hello everyone. I was a rehabilitation specialist with Integral Care for almost 5 years and resigned in October 2021. For the first 3.5 years, I was on the supported housing community recovery team, serving LOC 1 and LOC 3 clients. During my last year of employment, I was informed about a new ACT team, the Assisted Outpatient Treatment Program, otherwise known as AOT. I applied in October 2020 and was granted the position as the first RS. Prior to accepting, I requested 2 interviews with the previous practice administrator and program manager to clarify my role. As it was a new program, there were going to be bumps in the road, so I knew it was not black or white kind of tasks I would be assigned. However, I did not anticipate the absolute disservice to clients and chaotic disaster I was walking into. When I saw this opportunity to attend this meeting, I thought, finally, a chance to voice my grievances without repercussions and or fear of retaliation I would lose my job. I emphasize without because during my 1 year of service on AOT, I barely made it through. I tried countless times to express my concerns regarding the neglect, disservice to the clients Integral Care so passionately advertises to serve, the utter burnout AOT staff was experiencing, and the continued disrespect I received from my supervisor. My voice was dismissed. My suggestions for how to improve our team and its cohesiveness was never considered, and there were never efforts to make changes. Our supervisor was holding the roles for 3 different jobs. This did not allow time for her to support her team, manage the conflict amongst us all, or try to resolve my consistent concerns for the team and our clients. In addition to the literal lack of time she had for us, her perspective was the effectiveness of the quote-unquote evidence-based model of ACT services. This might be true if AOT actually implemented a true ACT model approach, such as all those required for LIAS trainings portrayed, but I can 100% say this team did not. This program should have never hit the ground running with such limited resources and staff while trying to serve such a high-need population. It was quite a mystery where the $5 million SAMHSA grant for AOT was being dispersed. For example, we paid out of pocket for clients' psychotropic medications and our supervisor would Venmo us. How is this acceptable? Many other basic needs for clients also went unmet. Again, where was this money going to? AOT did not have the financial resources and we did not have our supervisor support, which resulted in poor services to the clients that were court-ordered to engage with us. Yet somehow, still new referrals were being accepted because of the SAMHSA requirement for grant renewal. Taking on more clients when the current ones' needs can't be met, how does this make sense? It didn't. It was all about money and quite frankly, it was sickening. Staff was and is overworked. 3 of us quit within 6 months of each other, all under the same supervisor. I resigned because I was physically exhausted from the workload, continual disrespect as the professional and individual I am, and I've never felt more devalued in my entire career. If this doesn't raise a red flag about the working conditions for management, what will? This union that has been formed? Is anyone listening now? The staff who are actually out in the field doing the work, providing these real-time services absolutely deserve a seat at the table, and their input needs to be valued when decisions are being made. Otherwise, Integral Care will continue to lose hardworking and caring employees. It is no secret this agency's reputation has rapidly declined in the community, and your need for staff is evident, as advertised by your hiring incentives and self-report from clients and community partners. How can this agency expect to meet clients' needs when you can't even take care of your own staff? Integral Care's mission is quite literally healthy living for everyone. Be the change you actually say you advocate instead of just a headline. Thank you.
Hi, my name is Andrea Goldstein. I like to speak more like extemporaneously, but I'm too emotional to do that well. And I had like literally 10 minutes from 3:55 to 4:05 to do this, so it's not edited. Hi, my name is Andrea Goldstein. I've been with Integral Care for going on 12 years. I love this agency. I love the work. I love our clients. I love my teammates. I feel incredibly lucky to have found a career that I love. Sorry, I'm worked up. I've always loved getting up for work and getting to help our folks. Things have been changing, so it takes more effort to get in touch with my love and my joy for this work. But I do it because I love our clients. That's why I do it. That said, we need help. This agency needs help. We're in trouble. It's been in trouble for a while. That means I need to start speaking more candidly. I think we all should speak more candidly and not talk around stuff. Please do not take what I'm saying personally. It's not personal. This is not about us. It's about our clients. And please don't fire me. It will just make the staffing worse. And then I'm going to be like $150 an hour, there it goes. Okay, I'm going to tell you a bit about my life work. Okay, for the past 3 months, 4 months maybe, after 2 weeks notice, as the team lead of an agency at a community first village, 330 people. So I'm the team lead, right? Now I'm the team lead and I'm the program manager. I didn't have no training to do that, the program manager, but I'm figuring it out. And I have a caseload, because who else is going to do it, right? So, I don't want to take time off because I have a small team. I need to be there. So I'm not going to doctor's appointments. Look at me. Look at this. I mean, this is not like me at my most healthy. And I have the stamina. I can do this for the next 20 years. I will go to these meetings for the next 20 years. I don't give up. And I have very strong, motivation. Okay, please don't cut me off. All right, I'll get to it.
And we'll give you a little extra time, but we do have a 30-minute limit for everybody.
Yeah, oh gosh, okay, good. Okay, one team, two teams actually that I knew, they had a contract. The contract said 15 clients per case, one case manager. There was one case manager for all of those clients, 60, 65. And here's the thing, here's what haunts me, and this is really important. I'm skipping a lot. Oh, that's me. Come on, turn that off. Let's see. Okay, here's what haunts me. Something is haunting me. Shoot. Haunting me. I've known RSs who've carried caseloads of 60 clients. I need one more minute. When the contract clearly states the ratio would be 1 RS to 15 clients, so clients are suffering. And here's the thing. What if a client kills himself? What if a client kills someone else, right? That RS, I mean, what if they're new? They're going to feel, that might ruin their career. They're going to feel responsible for that because that's what humans like us do. They're going to think I should have done more, but they couldn't do more because we didn't have the resources to do more.
Exactly.
What if that case, what if that person sues, right? What if their mom sues? Who's responsible for, am I responsible for that? Is the case manager that's been here for a year responsible for that? What if it's covered by the papers, right? Who is going to be responsible? I think it might be the case manager, and that's why we need a seat at the table. We are doing this work. We are in a crisis. The house is burning down. I don't care about work culture. I don't care about your feelings. Put the fire out. Thank you.
Thank you.
And sign the file.
Jericho Sabase. I am the Director of Organizing for CWA. I'm just going to stop. Oh, they're just speaking into it, just kind of glitchy. So, you know, every worker here just discussed like how much they care about the work. They formed their union because they believed like not only they could be a supporter to the agency, but also a partner where they can actually give feedback and find a construct for how they can engage management in a constructive way. And we believe like this union has worked its tail off to really vocalize and urge this board and the public that, you know, in order for them to have a voice and have a real, you know, partnership with this agency, that this consultation policy is really critical for them. This isn't something that was made by the board, and it's great that you have your own structure or own group that you want to bring up, but these are your employees saying that they want a voice within their organization to partner because they care about these services. They are they are literally here screaming out to y'all that they believe like we can do better by our clients, and that this formation is one of the ways that they want to enter in partnership with this agency. And we ask you please to sign this consultation policy. There are hundreds of your employees who are saying that they want to be a part of an organization that works with you. And I just think that, you know, you don't get this a lot, and you have a prime opportunity to demonstrate to the employees of this agency that their voice matters, that their organization that they chose matters. So we urge you to sign the consultation policy, or at the very least engage with their union on the language that is concerning to this board, at that very least. And so thank you so much for allowing me to speak. Really appreciate it.
I want to make sure you guys heard that we are going to figure out a way of working with the union, and we are going to adopt the consultation policy very close to, I think, what you guys have proposed. There's maybe a tweak or two, and the only delay has been in evaluating the policy. We agree that there's, and again, this is a preview of what we're going to discuss more fully during our full board meeting, but we think that there's a way for the advisory committee and the union to work together for us to use both of those as a solution. So I point you guys just to have that in the back of your minds. Is feel free to continue presenting, but you'll hear more of that during the meeting.
To the extent that what I'm about to say is redundant based on what you just said, I'm sorry. My name is Mike Gross. I'm a 35-year member and still going of the Communications Workers of America and Texas State Employees Union. I began my career in 1977 with what was then the Texas Youth Commission, working with kids who had become involved with law enforcement. I learned then, and we've learned every year since then and before then, of the toll taken on youth and on our families by the just criminally, grossly inadequate mental health services in our communities. That's what those kids were there for. I later on had the honor to become a full-time organizer for Texas State Employees Union, and I worked for many years with the frontline state employees who provide the social and mental health services in our state. And I learned once again, it became more clear to me every year how crucial it is for the sake of those services for frontline employees to have the compensation, to have the workloads, to have the working conditions, and most of all, to have a voice, an effective, independent, united voice that creates a real seat at the table. So toward that end, I urge you to pass a consultation policy. And then further, because I'm going to keep on going, I ask you to work constructively with the union after that toward the end of providing the services that our communities really need. Thank you.
Ladies and gentlemen, yes, we're so glad you're here. This is the executive session. We're going to have our full board meeting next. We're also going to have our public comment section right at the beginning. I wonder if you would do me a favor and let us just take one little action under the executive committee. We'll then close that out and we'll roll right into the full meeting and we can continue with your comments. Is that okay? Is that good? Andrew, you guys are good? So really, one item that I would just like the board's consultation on. For the CEO evaluation, we have in the past, most of the times, used
single parent of 3 children. They all receive psychiatric care from Integral Care. I want to share the experience I had unsuccessfully trying to schedule a follow-up appointment for my son. Every time I call, I'm told that appointments cannot be booked more than 5 days out. Every time I call, my children's providers are fully booked for 5 days. So it's a game, and I call, I ask to get transferred, I ask over and over until someone transfers me to someone who books the appointment out of sympathy, because otherwise I'm calling day after day after day. So earlier this month, I called for a follow-up appointment because he began a new medication. He's 14, and spoke to 6 people. None of them could book the appointment for me. They shared with me that Integral Care uses just-in-time scheduling, and that I did a little research on it. It's a system that allows shift workers to schedule appointments. That's a noble intent, but it does not work if there's no appointments available. Please end this practice. I am lucky enough to be able to be here. I know there's parents who can't. I know there are people who need appointments who can't get them and just give up. I adopted my children from foster care, so they have Medicaid. Integral Care is the only place I can find that takes their insurance. Believe me, I would have left if I had other providers willing to offer services. I don't. The suggestion that I was given when I asked all 6 people, how on earth, what do I do? You're telling me there's no options, was to take my son out of school. He and I could go sit in the waiting room, and if there was any walk-in availability, we could have that appointment. I am speechless that this is considered acceptable for my child. He already missed a month of school this year because he needed inpatient services. He got a new medication when he got out of Austin Oaks, and he still hasn't seen his provider. Luckily, the medication seems to be working. She took sympathy on me and renewed it, but I don't know how he's going to see her next month. The system is asinine. Please change it. And if you aren't comfortable changing it, at the very least, please get the data on who calls and cannot make an appointment, how much staff time is wasted talking to people multiple times, or at the very least, How many providers are fully booked for 5 days? Thank you.
I'm Carly, I'm a nurse practitioner at Child Family Services. Sorry, my heart's beating really fast. Integral Care needs the union that your employees have worked unpaid hours for the past year to organize. The employee advising whatever committee will not work because we as employees have already tried to work within the system that executive management has created, which is why we're in the crisis of staffing and work dissatisfaction that we have resorted to joining a union. The employees have seen firsthand what happens when we communicate directly with David, the board members. We get results. We get your attention, and most importantly, we get the words put into action, and we are grateful. In the past several months, I've had to work more closely with some members of executive management. With my optimism and hope, I thought this would allow them to see more clearly through hearing firsthand experience of how the clinic functions or malfunctions, and would further into action to make necessary changes to operations. I thought that working more directly with direct care staff would allow them to appreciate our expertise, our leadership, our motivation to improve the ability to deliver care. I'm sorry to say that I was wrong. When presenting issues, I have been disregarded, I have been disrespected, and I have been treated frankly like a child. Scolded for doing things to help clients that had no negative effect on anyone, but simply because it's not our process. I would like to bring attention to the just-in-time scheduling and how it creates barriers to care, specifically in Child Family Services. Kids are at the mercy of their parents to call and schedule appointments if you're not aware. The policy states that if you call 5 or 7 days before your desired appointment, or you can only schedule 5 to 7 days before your desired appointment. Because of the unfortunate combination of being understaffed and increased need for services, there are no appointments within 5 to 7 days. Instead of scheduling the client at the next available time, the client is being asked to call back tomorrow hoping for an opening. There are clients trying to schedule a follow-up for an entire month. I saw one today that tried since February 14th and has called 4 to 6 times. The children are at the mercy of the adults and our mercy to manage their care. The domino effect of clients not being able to schedule but still having to request refills for medications affects the way I practice, which goes against medical reasoning and providing refills when it's not appropriate because I have nothing to do with the child. More complex than I can explain to you in 3 minutes, but I really hope y'all consider looking into this further and getting rid of that policy at the least in Child Family Services where it is a huge barrier to care right now. Thank you.
Late to the game. Sorry, y'all. It's down here. Hey everyone. Sorry, I was rushed over as fast as I could, so I missed a lot. And it is a little nervous at getting up here, huh? So hi, my name is Jennifer. I'm an LPHA at the Stonegate Clinic. I've been with Integral Care for about 3.5 years. And I think the thing that is important to me about the union specifically is that it is something that the employees have already come together to form, and it's been has a key role to play in addressing just the incredibly high turnover rate and the staffing challenges that we have that are definitely related to the pay issues and things like that, which we're really happy to see progress on. But it is hurting client care, and I think that, you know, being empowered is a really helpful thing with keeping people at the agency. People will stick around when they feel valued, when they feel empowered, when they feel like there's a sense of ownership over the agency that we all care about and the work that we all care about doing. And I think that that is one of the things that's really important about the union drive, is that it's been very empowering. It's definitely been times where I've felt like, you know, I got my clinical license and I thought about going elsewhere, and honestly the thing that kept me at the agency was the union drive. I feel really strongly that it's going to be nothing but a positive benefit for the agency, for our clients, for everyone. And so I think just being really committed to that and seeing that through will be really helpful. I'm very encouraged to hear that there's discussion about our consultation policy, and I would like to just, you know, thank y'all for considering that and looking at that, and I just want to make sure that, you know, we get to be part of a negotiation process with that we kind of, you know, work together to, so if there's any edits or amendments or anything that y'all want to see happen, like that we discuss that and, you know, we kind of come together to see if there's any changes that need to be made. So, yeah, like, you know, the Employee Advisory Council does not feel personally like it's mine. The union feels like it's mine. And I think that that is going to be one of the things that, you know, I mean, it wants to coexist. We can talk about what that relationship would look like, but I don't see it as a replacement. And I really feel like after, you know, dozens upon dozens of conversations with coworkers over the last several months, that the union is really what we all want to see. That is what I see light a spark in my coworkers' eyes, gets them excited, it shakes off some of that burnout, and I really hope that y'all will continue to support our efforts.
I'll be really quick. I'm not an Integral Care employee. My name is Bob Leibel. I'm a longtime criminal justice reform advocate here in Travis County. I'm speaking on behalf of a coalition of criminal justice reform organizations that have taken an interest in this issue. I think it should be in all of your inboxes, a group including the Austin Justice Coalition, the Texas Center for Justice and Equity, Grassroots Leadership, Ground Game Texas, the Statewide Leadership Council, which is a statewide entity of formerly incarcerated people, and the Texas Harm Reduction Alliance have penned a letter together along with some individuals about the importance of this effort. And we see this not as both a labor issue, right, for the employees of Integral Care, but also as an issue of justice more broadly in our community. If we are serious about building the institutions that keep people out of jail, that keep people well in our community, we need to create investments in our staff and our frontline workers that make that possible. And I think that's what you're hearing from people today. It's unfortunate that in our community that so many people with mental illness end up in the criminal legal system, right? We have a system in which nearly 40% of people who are incarcerated in Travis County on any given night have a serious mental illness, and that they stay in jail for more than 140 days on average, right? And I think that we can all say, and I've heard Chair Fernandez speak about this very eloquently, right, that this is not what the jail is meant for, right? And this is a possibility for an intervention to strengthen the mental health and behavioral health system outside of the criminal legal system. And so I really encourage you to take the union's suggestions very seriously. And I think that we have an opportunity in our community to really strengthen the mental health system and strengthen the cause of justice more broadly. So thank you very much.
Any other citizens' comments for the first part of our meeting? Of course, we'll close with the opportunity for citizens' comments. If not, we'll go ahead and start our regular board meeting agenda items. I'll say maybe a couple of things in my chair's comments. Welcome chairs, welcome. Our labor force, our workforce is our number one priority, not just today, always. And at least for the remaining year, if not longer, you guys are going to continue to be the number one agenda item on our agendas. We've got a lot of work to do. I can say, and hopefully through our actions, you guys are seeing that we are aligned. Our hearts and our minds are with you guys. We love this organization as much as you guys do, and that's the board and staff, senior management. We're not perfect. The board's not perfect. The organization's not perfect. All of our programs aren't perfect. It's hard to get everything right. There's always ways to improve. You guys know how much need there is in our community, and most people within our organization at every level is spread very, very, very thin. And unfortunately, people have to reach their limits before certain things get addressed. And we recognize that we've hit those limits in several areas within the organization. And we appreciate the union helping identify those for us so we can fix them. We've taken a couple of steps with the first round of compensation increases. We've got more work to do there. I'm pushing it as board chair. David knows I'm pushing them hard to make those actions happen. Trish knows as finance committee chair, and Luann as a finance committee member. And Deborah too. Yep. I was just thinking about the conversation you and I had recently. And we know that those things can't happen quick enough. And as far as the union goes, I think, just to jump ahead, I think that there's a way for the union to exist and for us to work together with the union. And as some of you know, the consultation policy, I think, is a workable document with a tweak here and there, which I don't think are very substantive in nature, just to help with meeting everyone's expectations. And we can talk about that as well. I know David is going to cover some of these points in more detail. And I think that there's a role still for an advisory council to play, but that doesn't necessarily take the place of the union. That's what's in my mind and in my heart. And those are my opening remarks. And with that, David, we'll turn to you to help us with the first one.
Yikes. Thank you. Thank each of you for your presentations this evening. You've been working over a year, and it's evident in the coordinated presentations and compelling detail. And as I listen, I want to follow up here. On December the 6th, a little over 3 months ago, you met out front and presented to our organization a neutrality agreement. From talking and listening to the individuals, we heard that there was some misunderstanding that we may be a nonprofit, and some of the collective bargaining that was contained in the neutrality agreement was not legal for us to proceed on. I think that was a tough start. I think that it was tough for me because when I heard that your interest, and it was clearly outlined, was better working conditions, and some of that this evening, improved safety for clients, for staff, better outcomes from treatment and our approaches, and better compensation and benefits. You probably remember and would hold me to it that when I heard that, I said yes. And then it seemed like a week later, I was saying no to a neutrality agreement. I've been asked to meet now and respond 5 times. Once was a meeting with employees interested in forming the union. I thought we had a good meeting that evening. I listened. We had an opportunity to hear from one of you who identified as a member when to join the union on the death of one of our employees, hard circumstances, and asked if I would be sure at the memorial that we had staff honoring her and we did. I heard back on what's our naming policy, so when we have an advocate or an employee that stands out, that we can remember not just them, but what they stood for and what they brought in their approach to work. And so we have had follow-up on that naming. And twice I've heard, directed to myself, on working conditions on our Riverside facility in terms of flooding, and then any follow-up on toxicity or professional readings of the environment in air quality. And within guidelines, I supplied the answer and full test results and was thanked by the union in that regard. Now we have the consultation policy, and I went back and I reread what I wrote you, and I can see why there could be some misunderstanding, but for me it was a reiteration that we currently have 8 standing, ongoing, employee participating committees. We also have our policies and procedures, and we also have the suggestion box. We're also putting up on SharePoint for all 950 employees accountable recommendations and what the disposition of those recommendations were. So as I've learned from and looked at and have consulted on the consultation policy, it's not a matter of saying back, no, we have an employee advisory committee. What we have is a 3-page procedure that's going to roll up 36 employees that are going to take those 8 employee-led quality improvement groups and in some kind of an aligned way bring that information through in the same kind of periodic recommendations to the board. So we have the gravity and the alignment of those kind of recommendations. So there's misunderstanding, is it competition between an employee advisory council or an employee union? It's not competition, it's an aligned, complementary approach that I think will be more holistic, representing the employees. I would anticipate the union growing. For those that haven't read it, the consultation policy talks about a threshold of when 5% of the employees join formally the union. That kicks off an authorized union representation. Also considering the 95% as we continue to move forward, and that will be rebalanced. It's a living document. It will be an approach that we learn from. So this evening, Chair Katz already set the stage that we're going to have a generative discussion. It's not a PowerPoint. It's not me supplying the answers, but it's framing the issue for the board to provide guidance back to our executive management team. And I just would like to make these kind of brief comments, if I could, to the board to kind of set the stage. You've heard this evening, and you already know that workforce is the #1 issue in healthcare. Read about EMS, read about the teachers union, across the board with our federally qualified health clinics. Workforce is the #1 issue. Some of our board members and staff are going to be attending National Council. The #1 issue in our National Council in 2 weeks, our trade association at the national level, is workforce. And what's that conference titled? Redefined. It's my belief in best practice approaches that there's no going back to somehow the way things were over 2 years ago pre-pandemic. But we need to redefine the work and understandings and the valued voice of the employees. Changing culture is what's going to be redefined for the very best in treatment outcomes and the goals that we heard this evening. So, the discussion tonight, if we're going to look at this holistically, needs to be framed in, we're holding staff forums. We've scheduled another coming up. This time we'll take on questionnaire questions to respond to with board and executive staff. We have the union consultation policy that really lays out an ability to actively listen and to bring forward recommendations for policy consideration. We have the class comp study that's running in the background, and we'll hear a little bit about that this evening. Just say one more thing, that the Employee Advisory Council is to help coordinate. And these are the names of the current ongoing committees: recruitment and retention, diversity, equity, inclusion, and belonging, risk and safety, clinical workforce quality and satisfaction, employee learning planning committee, our quality leadership team, and our technology advisory team. That committee, too few, those are over 150 of our employees that are engaged in those activities to bring recommendations forward. I went back and looked, it's too top heavy, and in some cases it's some of the same leaders that are on several committees, so we do need to improve in that regard. Also want to mention that we have another survey out, and we actually have some recommendations on use of technology to improve surveys, and we're going to be looking at that so the voice can build within the survey process on employee satisfaction, continue to learn from that. Workforce is the #1 issue for the local mental health authorities across the state. I mentioned this, it's the issue for this year's national conference, and the board, as a board, you've got a generative discussion focused on the component parts that we have moving forward on this issue this evening. So I promised I wouldn't go into a monologue, but I do want to set the stage here, and maybe repeating myself, but in terms of this employee advisory council and the employee consultation policy, these are 3 pages of straightforward work. So at any rate, that's the process that I'm bringing forward this evening. So I'd also like to ask David Whedon to join us, because I had mentioned in terms of, you mentioned keeping an emphasis on this topic. And I really want to take a moment and look at a status report on where we're at investing in our workforce and what are some of the component parts. This is not a PowerPoint presentation talking at you, but this background data and financial information. David?
Yeah, and there are a couple of things. One is some of the additional investments that we've been making in workforce over the past 7 months. And then 2 is some of the challenges we have in timing as we look forward for future incentives and improvements. So what you'll see at the top of the screen is the items that were incorporated in the budget when we adopted the fiscal year 22 budget that were new investments in the workforce. Obviously, the biggest one was the additional $2 million in health insurance due to some of our claims expenses over the past year. But we did also have crisis stipends for some of the units, a nurse increase, clinical supervision was added, on-call pay increases, and shift differential increases. It had been, I believe, at least 15 years since we had addressed those ancillary pay categories, so that was a step in the right direction. Since the fiscal year has started, we've also incorporated some additional bilingual increase adjustments, as well as some additional crisis units. And then, of course, as you remember, the large adjustment that we just finished on the minimum wage approach and the categories that affected as we move forward. In addition, some items that were addressed by the Policy and Operations Committee is Wood Group, who is a contractor with us, has also been facing some challenges in getting workforce. We did request in the last request for proposal that they include at least a $15 per hour minimum wage rate. In the contracts that we have with them, that'll be about another $800,000. So in the new investments in workforce, not counting any new positions, we're at about $9.6 million since August, and those are for the ongoing investments. In one-time funds, we did do the incentive in December, which was about $780,000 in investment. And since the beginning of the fiscal year, we've been doing the sign-on referrals and the referral incentives, which have already accounted for about $146,000, and some of those are continuing. As we look ahead, excuse me, one of the biggest challenges we have going into this next fiscal year is the ending of the delivery system reform incentive payment program, which accounts for about $13.9 million of our annual revenue. As we continue on that, we know there will be the Public Health Provider Charity Care Pool. We are currently using the first few months of this fiscal year to try to estimate how much we'll have coming in for that in the next year. That will take a little bit of time to work through as we try to get some clarifications from Health and Human Services on what we have to exclude and what we can include in those costs. In May, we will be getting our prices for the health insurance renewal for the next year. We do know that in this last year's price, they had discounted us $225,000, and we do know that that will be coming back on. And then they did agree that we would have a cap of no more than 9.5% increase. So that has a potential of about $1 million expense as we move forward. And then the class comp survey that David referenced, we're supposed to be getting the draft report from the consultant around the middle of April. So we'll have that coming online to help identify where we have the largest gap compared to the market to help prioritize as we move forward. So a lot of this, I think, as we get towards the end of May, we should have some real good estimates on what we're projecting for the next year, which should help us align and kind of time for what kind of recommendations we can make moving forward.
And I guess we can take the number issues first. David, simultaneously, are you working on some estimates? I would think we have some idea of the comp and benefit increases that are going to be necessary for the, what I would say are the second and third groups of employees. If we take the first group of employees that have already been given the increase in comp and benefits, if we broke out the remaining employees into two that naturally kind of would be into two different categories, I would think you would be starting to play with those numbers a little bit. And I would hope you would start playing with those numbers. So once we get the comp study back, it will be more fine tuning, because I really want to go quickly with that second group of increases, as we discussed a month or two ago. That was
So, yeah, so my biggest concern is being able to get an estimate on the public health provider charity care pool to ensure that that will be able to replace at least the district and hopefully a little more, which will get us some funds to help address this.
Yeah, but I think you're coming at it a little bit differently. You know, that's how do we pay for it. I'm not telling you need to figure out simultaneously how you pay for an increase in comp and benefits. I'm saying let's start modeling what increases in comp and benefits might look like, and then we can figure out how do we end up paying for them, how do we roll them out based on what happens with the federal dollars. So between your great mind and Trish's great mind, I think we'll be able to come up with some options.
Another potential interim step that we can look at also is it's anticipated that the public health emergency will be extended in April. If that happens, then the district payment for this year will have the enhanced FMAP, which will bring in about another $1.2 million. And we could look at dedicating that to incentives for the employees across the board as an interim step to help as well.
And while we're looking at numbers, you know, one of the comments that we've heard from staff and others is we need to balance the needs in our community and, you know, hiring more people with, are we taking care of our people, are, you know, sufficient? And we know that there's some revenue issues, because when you expand, you also have more dollars coming in, so you're growing to get more dollars, and you're always kind of chasing the dollars, but do we try to do more with what we have instead of increasing access? I mean, you heard a plea for access this evening, and so it's really hard to say we're not going to grow with more capacity because we don't have enough funds to pay them, you know, the people that we would need to provide that care a livable wage. But so how are you, and Trish, maybe you can talk about that, how are we considering growth opportunities with this need to take care of the staff we have?
Right, and that is one of the challenges where we're going to have to go back to the city and county and some of our funders because the vast majority of our funding is basically an enclosed funding system, where regardless of how many additional people we serve, how many additional staff we have, it's the same funding amount.
Questions for David, leaving on the numbers, I know we're gonna circle back, I'm gonna circle back on some of David's, earlier comments too, but while we have him in the hot chair,
And I have a question, and I'm wondering if we can, so assumption being, if we take good care of our staff, I mean, I know how hard stress is on an individual's health and well-being. And so our health and dental insurance is going to increase, it looks like, by about $2 million. And
So the $2 million was last year?
was last year.
So the
okay.
maximum it would
But
increase
it's
would
going
be
to
about $1 million.
increase because of it, okay. So what I'm wondering is if we can start tracking data and looking at, as we invest more in our staff, what are our costs for health and dental and our, because the assumption would be if we're taking better care of our employees, that their health and well-being is also being considered in that, and that hopefully our costs for that will be less than maybe what they have been in the past. I don't know, I may be making an assumption that's wrong. But I would at least like to just look at the trends over time. I don't know what other board members think about that, but.
Yeah, and we can pull some of those together for you. The vast majority of where we're getting causes for increase is because of high dollar claimants, when we run into leukemia cases and some other things.
You want to see utilization.
Right.
I was just gonna say that echoing with the sentiments of knowing that if the funding, with the contracts that we get from the county, from the city, is very prescribed and programmatic, then we should definitely look at the collaborative effort between the board and executive management to foster that, to have that conversation. To know that we need to be looking at those contracts and making them aware of what that looks like on this end with the workforce because of how the contracts are written. So I think that's a big part of it as well. I also think that, I know that agencies can typically have individual positions, but sometimes if you actually get into the weeds and see that there's 2 or 3 people that are efficiently managing that department or that area, instead of having someone come in at 30,000 or 45,000, I bet those 2 people or 5 people would rather see the increase of a $10,000 raise, and then, shrinking that amount of that new position to be able to have some of those funds. If we have 300 jobs posted that are already funded, where can we consolidate to shift funding to the existing workforce? And that should be looked at.
Well, would that even work with a prescribed contract? Because
Right.
typically the contract will actually say you get to hire 2 FTEs, for example, and provide X number of services over this 1 year. So if we come back and say, well, guess what, we're super efficient, we can do it with just 1 FTE, that doesn't help us draw down that money.
Right. And
So
just,
some of this is educating the city and the county, I think, personally, as well, because some of the city council members that I've talked to don't actually understand how we get paid, they don't understand how the city pays us. I think a lot of our contracts are old, they're 6, 7 years old, we keep renewing them, maybe at the same amount, maybe more. But I mean, I do think it's gonna take some realignment, with the city and county to be able to say, listen, I mean, if you want us to have 20% better pay, or you want us to have 20% better benefits, or you want this, you can either choose. You can have less services for every dollar, or you can pay us more money. And the problem is at the end of the day, like, Austin's a closed system, right? Like, the city of Austin only gets so many tax dollars, and so that's the struggle I see in all of this is. But I'll tell you the big thing that I've kind of taken away from talking to some of the city council members is that I don't really think they understand. I don't think they understand how they contract with us for services, and what they could be doing. So part of like when I talk to them, I say, well, you need to look at the contracts that we have with you and decide, what you want too with these services. Because if you're looking at rates from 6 years ago, that's not great either.
Right, and virtually every contract that we have with the city and the county is a cost reimbursement-based contract based on the positions that they have included in the budgets on those individual contracts.
Yeah. So it's capped, right?
Yes.
Essentially.
And I know one of the strategies that we've talked about is seeing if the city and county would be considerate to combining the contracts that we have with them into one contract with the various scopes of work, but then where we could have some flexibility in some of the funds moving between one and another.
Yeah, where we get more control over the staffing, as long as we're providing the services.
The services that are in the scopes.
Yeah.
So, do you have a projection of when that charity care pool information may be provided to?
I'm hoping to have those estimates done by mid-May, because it's just some detailed work that we need to do to get there, to find the different situations, which would time out about the same time as having the dollar amounts on the health insurance as well. So that would give us kind of that big picture moving forward. Because those are really the main things that are changing as we move forward into the next year.
Feel confident? It will be the extension?
I feel confident on it. The one thing we won't know for sure is if the overall statewide will exceed the funds that are available, and if that will cause kind of a haircut, but it should give us a fairly reliable estimate.
Now, you're talking about, like kind of categorizing employees, like this is the first pool that's gonna have something happen, and this is the next. And I apologize, I was sick at the last board meeting, so I didn't get to hear some of the discussion. Was that discussed at the last board meeting, or?
We identified the employees that were at the lowest end of the schedule, and they were a priority. They were a priority for us in increasing their benefits.
Yeah.
And there are people who were right there on the edge that we need to get to next. And then I think based on.
So just straight up on like an hourly rate?
Yeah, on that first group of people was on an hourly basis.
Okay.
And the next two, I think, I'm just, throwing out two, if we need to break it out into, other, segments, we can do that. I don't wanna extend it too long or overly complicated. But if management needs more time to evaluate, financial considerations, and making those common benefit decisions, that's a way of giving them more time while still addressing the next group of people that have an immediate need.
And is the Contemplus looking at every FTE, every position in?
Every position across the organization and using data from similar organizations as well as other organizations in the immediate area.
So it's geographically specific to Austin, Travis County, or is it also looking more broadly at?
So some of both. It has a subset of other community centers, but then it's also looking at like the city of Austin, Travis County, UT Del Vet School, all those that they can have some type of public access to the information.
And just another quick question. So when we look at our total FTEs across the board, regardless of the position titles, and we think about funded positions versus unfunded positions, there might be a piece here from city, a piece from county for one FTE. To Devin's point, is there a way to look at what our average turnover is, and then using that information to look at the funded positions and whether or not we could take a risk and look at the assumed percent of turnover when we're doing well? I mean, I know it's higher now just because of the environment we're in, but what our average may have been before then, just to kind of get a feel for what I guess what I'm trying to say is there a way to kind of look at that information, look at the finances associated with that, and then use some of the resources for the funded vacancies to fund fill, knowing that there's going to be a need for a certain number of FTEs to get the work accomplished, but also knowing that there is always a turnover rate.
Right, so we already have some lapse built into the budget itself from when we start the year.
Okay.
In addition, in looking in that model, we would need to do that contract by contract, because we wouldn't be able to shift to a different funding source necessarily, because it wouldn't meet the same parameters of what that
Like
contract.
25% of an FTE from the city would still have to be 25% of an FTE.
Right, and even with the city and county and the state, each contract sits by itself, so it's not just city funding, it's city funding for this particular program at this particular site.
To Sarah's point. Okay. Okay, just thinking creatively.
Mhm.
That doesn't go over well with the government.
So, but we do look at that, and we have looked at that on a regular basis.
And have we started to have conversations with state, city, county, and other funders about this? Just in terms of, what we're talking about, this is the revenue we would need to maintain where we're headed. And if you want us to continue to have the expected performance targets for whatever the specific projects are, and what that's gonna look like in the future.
So with the state, we have started the conversations through the Texas Council to try to get an exceptional item to address workforce issues across the board in all the programs we have. I know with the city and county, I think we have a unique opportunity right now as they have shown support with some of the ideals that the union has brought forward, in helping bring that to their attention as one of the ways that we need to help address it.
I've had conversations with individual members that will look in their budget process as to the right time to address the bodies of the city council, county commissioners, and then we have an upcoming meeting also with Central Health.
Okay, excellent.
I would love for us to come up with a proposal for the city and the county around some specific programs, and almost as kind of pilot projects, where we present to them a change in how they pay us, where they get the same level of service, maybe even at the same dollar amount, and free up how we deliver the service, and we're measured more by outcomes and deliverables than the people who are actually, we're employing to perform the service. And see how successful we are with, 2 or 3 proposals along those lines, over a year or so, and make them limited duration and say, let's see how this works for you, and let's see how this works for us. Trish, you have other thoughts?
No, I think we know what the plan is, we just need data. I think to your question about, are we working on understanding what the increases could be? To me, a lot of that is going to be driven off the data we're supposed to get in a couple of weeks. So we understand what kind of gap we're looking at through the complex study. To me, that sets probably the largest parameters, and then we have to drill down. We have to really understand where the gaps are, and then I think that all the items that have been discussed tonight about the priorities, that we're going to have to make some decisions about where we focus funding. We're going to have something. We just don't know what the something is yet, and we're going to have to be very, I think, flexible about how we apply that. So it's really a 2-part process. We've got to really understand what the gap is, and then we have to understand funds that we're going to have and how we're going to apply them and how that meets our priorities. So I would envision there's some, I don't know how we're going to put it together yet, but there's, probably some criteria or some that we can apply in terms of what we think are the highest priorities. Or maybe it might take the form of options, that we can work with that.
That's what I see, and I don't think we need to wait too long for the study, frankly. I mean, we've got a good idea of the percentage increase that the study's likely to come back with.
I think.
How we fine tune specific, groups of people, but I think we've got enough to be playing around with ranges.
Yeah, I think what you probably have a good sense of the overall, but what I don't have a sense, and maybe the staff does, because I'm not there day to day, is just where are the biggest gaps that we need to close.
And the reason why this is important to me is I think when we say we're waiting on a comp study, and it's not gonna be here till the middle of April, or we're not gonna be able to know anything until May, then the staff hears it and thinks we're just, waiting for someone to give us a report, and we're not really doing anything between now and then. And I think we don't need to be waiting, and there is, we can show them that we're, preparing and coming up with ideas in the meantime. I think that will be productive, both, mentally, emotionally, and just physically.
Right, and the biggest reason with the May target date is just because of figuring out that potential replacement for the district funding, since that is such a large portion of our budget.
Yeah, I think we could come up with options there too. I don't think there's any, way. We're not gonna make a decision until we have those numbers, but we can definitely be looking at ranges and, if this happens, then that, and if that happens, then that.
No, I just don't agree. The scenario planning of things, and that's kind of, we should put ourselves in a position where we will have a clue.
Well, the other part of it too is that the conference class review will be point in time. It will be delivered to us in a month in 2022, so we also need to be thinking in the future how to keep up with the cost of living in Austin, because it just seems to me like it's just continuing to, so we just have to bear that in mind too.
Right, and that is where we do have the discussions with the state on trying to get to the diagnosis-based eligibility for Medicaid and the CCBHC payment model as designed at the federal level. Because then we are in a situation where we have increased services, it also increases the funding, which allows us to address some of those things on an ongoing basis.
Yes. And the state may have to negotiate different rates with different LMHAs because of the location where we are. I mean, it costs more to operate in a city like Austin and Travis County than it does in a smaller rural county. So.
And that's exactly how the CCBHC model is funded.
Does it take into consideration cost?
Yes,
Is it like the FQHC model?
it's very similar to the FQHC model.
So let's talk about the consultation policy. The board may remember that the union proposed this consultation policy, and I've asked David and we to look over it and make sure that they didn't have any significant questions or concerns about the policy. I think it's something that we can live with. I think David has a suggested change, maybe just one suggested change. But I think this would be the mechanism and kind of the guiding principles of how we would communicate with the union. That's not going to be the only way we deal with employee issues or workforce issues, but it's the place that we all will look to set the standard for those conversations. And you want to talk. Hey, you know that I'm in favor of moving forward. As a board, you guys hear me saying I'm comfortable with it. It's not a contract. We're not agreeing to make any particular decisions. It's just the flow of information, how regularly we touch base. But I'd like the board to chime in, and David, you share your thoughts.
I've not heard one negative comment from any board member or any employee about not moving forward to fully listen and fully engage the union. So in reviewing the consultation policy, there's two things I think that you as a board are going to need to look at. Do you want to pass this as a freestanding policy? Look at the wording and pass that. Another choice, as an example, would be with our employee advisory council that you said you see that as part of the integrated quality plan, and that would go as a charter into our required quality plan. So in that regard, there's a couple of ways forward on actually processing as a board the document itself. And I'd like to actually meet, I don't know with Seth or who's going to be the representative lead on this, but I'd like to talk about embedded in meeting with management, one process that identified as voting. And I just want to understand how voting actually reaches kind of the spirit of listening and consultation, and then following the policy and bringing proposals and ideas during possible action to the board. So I'm very familiar with it. I read it through. I've consulted with attorneys, and those are the 2 points that I would ask you to consider. This is not style for action tonight. I don't have any reason to believe that as a board you couldn't give guidance and act on this at the April meeting.
And would it need to be approved by the board? I mean, or do you just need our feedback on moving forward?
Correct.
So that's an option, just to give our feedback.
Yes, I can list all the options. But, yeah.
I was just gonna say, how do you want feedback?
I'd like to circle back and get some further input from the executive committee. After tonight's this whole idea, is just to generate the discussion and the orientation. But on all of the items, consult on how these are going to be brought back before the board and what the agenda looks like. And then in addition to that, any individual further conversation or note, fully incorporate that also, like we do on all proposals.
And this isn't going to delay your continued communication and meeting with the union between now and the time we make the formal decision. Is that right?
That's correct. I'd like to have an invite to meet next week. I'd like to keep momentum on this. I'm getting a nod or two, so I think that's probably going to happen.
But let's just tease this out a little bit more. Your specific concerns. One was the idea of voting, how the document contemplates a voting versus making a recommendation. Do you have an example of just initial thoughts on what your change to that language would be?
Kind of laced in the language is consultation, voice for improvement, and I'm just picturing sitting down, identify as one union representative and 4 staff, and then myself, and then up to 4 staff. So theoretically, we sit on the table, there's 10 of us, and the proposal comes forward, like we've heard this evening, on the scheduling of children's clinic services. I'm just making this up, and listening to this evening. I still want to talk further. What would that mean to vote? 7-3 vote, a 5-5 vote. What would that mean? And also an opportunity to bring back what are some other scenarios for moving forward.
So that would be a union vote, though. It sounds like that would be a union vote. And that vote, the result of that vote sounds like it would just be a communication that you would take back to the board and report back to the board.
That's how I read it. And so I'm just trying to think through, and that's why I would like to talk to the representative. One of the things that I didn't mention this evening is that this idea that we're clear employees can join fully under the law of the union of their choice. And then how does local government receive consultation? What we have here is what was communicated as sort of compiled model. And so I have talked with legal staff at the city, and I've talked with county officials on how do you receive information from the union, and how do you process that information? I haven't stumbled onto anything called a vote yet, but I have understood some of the processes that have been through. So, and I might also ask for is just not just a compilation, but maybe some actual examples. I could ask for these on my own. But what does the union think works well with some other city, county, as an example? AISD as an example. So we can also learn from that. So to your point, yes, we can come back and I can report we met on this issue, and there was a 7-3 vote. And what does that mean? And what was
I mean, that just, to me, that's just going to reflect the opinion of the union and the representatives of the union, and then we take that information and use that along with the other information
in agreement with you. I think this agreement can peacefully coexist with any other, employee committee that we have, including the employee advisory committee, so I have no concerns about that whatsoever. I'm not prepared to go through on a, you know, issue by issue. There aren't many, but there are a couple of things that concern me. That's a minor concern for me, what David's raising. I think we can deal with that. It has to do with how many people there are on the committee as well, and what that vote looks like. You know, for instance, there's a representative from the union, and then 4 other union members for every union, and they're on the 4 management members. So it could be, depending on how many other folks we've got, it could be kind of have an interpretive issue about, as David said, what that meant. The thing that David did mention, and that I have the most concern about, is that there's a line in there that talks about this being the official employee consultation committee, and I would just change it to an official, because it's one of several. Yeah, it's a way of gathering information. Yeah, and that's not a concern for me, so.
I was gonna say, I have a question about the 5%. It sounds like a city basket kind of thing. Where did the 5% come from? Is that consistent with other, like, city or county?
Yes.
Can you, before you answer that, I don't understand what that provision is. Can someone explain that again to me? If 5% of the employees join this union, then what?
5% of the non-management, and there are definitions within the policy, but management is considered anybody who is above the level of program manager.
Okay.
So anybody who's program manager and below, there are 5% of that number who are confirmed union members, then that union would have the representative folks that are named there, the number of folks participating in this consultation.
In this committee?
Yes. Okay, that's right.
And Lucy may recall that the title of that is authorized.
Yes.
Well, but what does that mean? That still doesn't answer my question. What does it mean to be not below 5%? And
Below
above 5%,
5%.
what changes if there's 3% versus 6%?
I don't know where the number came from.
But what changes?
The number of people that.
Well, whether that the union is able to participate in this consultation committee.
What it says is, it's number 6 in the consultation policy. It says that constitutes a qualified employee labor union. Organization, sorry, qualified employee labor organization. That's
And then be entitled to have a certain number of members participate in this committee, attend the meetings,
In this
vote, have
consultation,
discussion.
in this consultation
Yes.
committee? Okay, that's what I was trying to get at. Like,
Sorry.
what authorities, values does it?
That's the minimum level for the union to participate. Has a
Okay, and if
certain
the
percentage.
union never gets to 5%, they're never authorized, they're not an authorized participant?
And there's a provision in the policy for any number of unions, it's not, it doesn't contemplate just one. So,
I'm trying to understand.
So there
what
could in
that-
theory be a second union that would then, if they could hit the 5%, would add 4 more members?
correct.
Okay, all right, just want to make sure I'm reading it.
Yeah.
So my only concern is just knowing that, good intention, great idea, they go to bureaucracy and red tape to that. And so in both fronts, when it comes to both the union and the DAC, it's making sure the person at the call center is represented just as much as someone at this level. How their concern gets brought to the table, or someone brings their concern to the table, and it doesn't all get policy. The majority vote that this is more. So making sure that all program areas, the employees have representation, and an equal seat at the table to voice their concerns. And knowing that, I just want to make that argument.
I think that's a really important point, because anything can become a bureaucracy.
Right.
And just, people start organizing themselves together, and you can create bureaucracy. So I think that's a really important point, is don't lose sight of what we're trying to accomplish.
Yes, by all the procedural stuff that is going to serve any good intention is successful.
Yeah, I kind of wondered about that myself, because for employees who are members of a union. What about, like, out of 950 employees, not 950 employees will be part of a union, so what happens to the percent of employees that don't have union representation, and how will their voices be heard?
That's the employee.
And that will be the EAC, so they can both
Yes,
operate
exactly.
simultaneously, one for employees who are not members of the union and one for
Correct.
employees who are, okay.
That's right, they're gonna coexist, and we're gonna talk a little, I have a couple more thoughts that I wanted to talk about. Just like the EAC, but I wanted to make sure that the union members heard us clearly on where we are with the policy and what our next steps with the policy. I would request that between now and next meeting, you guys work with the union and get your questions answered, share with them our concerns, our specific changes, requested changes, and you can get our feedback. With the executive committee, we need a special meeting, we can arrange for that, give you our feedback. But I think we're all on the same page with needing this to be something that helps, that solves the problem. It's not another bureaucratic step, and is manageable. I think it can serve that purpose, and it's not going to be set in stone. If it doesn't work, if both sides say this is not working, we need to change the policy. You can always, either side can come back and say we need to change the policy.
Which is ultimately up to the board.
Right. Yeah.
So, as a board member, I would like for the full board to hear that conversation, so that we're all aware of, of what is happening, rather than just limiting it to a few.
Well, that's great. I just know that they want a
We'll call the
policy.
executive meeting. Anybody can come.
Yeah, that's great.
Everybody
Okay.
gets it on their.
Yeah.
Okay.
I'm just trying to get it done before next
Okay.
meeting.
Okay.
And I don't think we're that far apart.
Okay.
I think this is just some fine tuning of the policy. Okay. On the EAC, the first thing, so we definitely support moving forward with a body that represents all employees, because everybody may not join the union. Right. Back to what Deborah was saying and Trish emphasized, bureaucracy can kill anything, can kill everything. And I'm afraid the committee and then the advisory committee and then all the 8 committees that you've got underneath it is just a huge bureaucracy. I think we need to, as you started to do, you said you started looking more closely at the committees and realized that the composition might be too top-heavy. I think there should be a review of all committees and likely a reappointment of all committees, a refresh of all committees. That doesn't mean everybody's got to be taken off those committees. There'll be some people that stay on, some people that shift around, but I think that's going to be an important step in moving forward with the EAC. Yes, ma'am.
I was gonna say, in looking at it, what I would, just like the voice, it would be great to know that the executive management is more in a co-chair position than actually chairing one of those committees, and knowing that it is not within that same department of where the employee is represented, so there's no conflict of interest, or just making sure that the employee voice is empowered, and knowing that EAC is really to serve as a place for them to be heard, and just keeping that again in the forefront of how it's structured the organization, and knowing that 16 chairs and after reading the survey does not represent all serving. Knowing that there's people that are in departments that even if they did not join the union, they would not be represented in the EAC. So knowing that needs to be restructured to where everybody, regardless of title or position, has a voice on the EAC. And then just the verbiage, because of all of the terms, the years, the language and the voting, again, we just talked about it, it's just, I don't want it to circumvent to where if paper maybe to have checks and balances, but then project it's a nightmare for those who are actually having to see it play out.
Any other comments? I think this has been a healthy discussion, productive discussion. Thank you. David, board members, Lisa, David, Stephen, staff, thank you again for being here. I'm going to move us on now to the consent agenda, if that works for everybody. Is there anything on the consent agenda that someone would like removed? If not, I'll entertain a motion. Fish.
I'll make a motion to accept the consent agenda as presented.
My credentials, rather, for 30 years of working in advocacy for diversity and inclusion, affirmative action. I'm originally from New York City, born and raised, but I have been in this line of work for the last 30 years. I've traveled, worked as a consultant overseas, in London for the last 18 years. And I think that with all of this understanding and this knowledge that I have obtained, I welcome this opportunity to work with all of you. And is pooling with some of those that I have met in my travels to bring awareness and bring practicality and be proactive in helping these decisive positions be obtained and maintained, so that way the communities that we work in and that we serve become part of the heritage that's built in this foundation. I'm still learning a lot of the processes, but I have great awareness and practicality on all business concepts of being able to look at what diversity really means. I stand for working for the people and to be able to engage that with all of you to keep this insight and this commitment that we are choosing to obtain with the teams that we work with, and to make sure that the continuity and ambiguity make sure that it stays within the consistency. Throughout my career, I've learned that to be able to obtain authenticity and genuineness is to be forthcoming. And that's something that I plan on doing with the work with inside of Integral, and making sure that we don't lose the insight of the people. I didn't get your name.
Deborah.
Miss Deborah.
Yes.
She said something earlier, and I'm not going to take up time, but it was something based around the potentials of other lower workforce people not being able to have that voice. I would like to motion that process should fall into my department. That's something that I would want to take that challenge on to, because I too was an individual where I felt that I didn't have a voice. And I always swore to a duty that once I made this opportunity to advance my career, it was based upon me having an understanding not to forget where I came from. So I bring that due diligence with that same concept, so that way you and all of the board members can have an identifying person, face, value, that will be able to bring that insight and make sure that it stays consistent, because I too want to make sure that no voice is not being missed or unheard, and those that feel the lack of representation on all sides of humanity. My peers have already heard me say that word, but there's someone that had brought awareness to me of a word that stands out inside of this whole process. It's called a mission. And I think if we lose sight of the mission for the workers that need to bring in a lot of this processes to make sure our community survives, then we all lose. We all fail. And that's something that I do not want to be in a position to make sure. So I will be very precise in working due diligence on all of the matters with David and the rest of my peers to make sure that my experience and my practicality brings sufficient evidence to make sure that this data is presented. We're leading by practicality, and we're making sure that the workers that we see here that represents not only the community, but represents us. And I want to be part of that, and I thank you all for giving me the opportunity, and I look forward, as me and Louise always talk, to be able to keep learning this process, because I know that coming from an outside, I want to be that listener, and I want to be able to engage, and I hope you all welcome me with that open arm to be able to bring suggestions. I think that's what you need as far as wanting someone with fresh eyes to to bring some more continuity to the table, not without any dictatorship or demise, but just out of love and respect to make sure that we as a committee and peers, we win for them and as well as the community that we serve. So thank you.
And vetted and hazed. Particularly that part of New York City. And this is not his first rodeo, if you will, and he is not new to the Austin, Texas area, and I believe parents are living in Harris County area. So he is a homeboy. George, Ms. Lentz?
Thank you so much for refreshing our thoughts. It's been a while since we reviewed that, and it's always held on more than a year in the committee. So I'm just going to go quickly to the areas that we're working on right now in terms of our last meeting, which was earlier this month. As you all have seen, we've met Mr. Muldrow. We're happy to have him. He had a chance to engage with the committee in our meeting with March. We also reviewed recommendations of alternative credentialing for qualified mental health practitioners, and so that was very helpful. There's lots of activity that is happening on the state level to kind of look at this issue as well. We also discussed our progress with Smith and research, and as you all know, we got some preliminary data from them, but we'll expect more later. We also have hit what I consider that 100% of employees reaching having all reviewed all three of the Tower Evolutions. So we're right on target as far as the educational materials. Now, next month, we'll be bringing back kind of a progress report of where we think we stand in terms of those strategic goals and those plans that were developed back in May of 2021 that the board approved. With that said, that's it, unless there's any questions for me, Mr. Hayes, or Mr. Nolso.